Alright, Iqbal. I can hear you.
Alright.
Hi, Assalamualaikum. Is anyone hear me?
Yep.
Alright, can I
Yes.
have all the participants to open their cameras?
Yes.
Quick attendance. Is all the speakers from each team are ready? Do we have Dr. Chen and Dr. Aznida in this room? Dr. Chen and Dr. Aznida. Dr. Jamal Hussaini, can you hear me?
Yes, I can. Can you hear me?
Yes, I can. I'm really sorry, doctor, but I think you are assigned to be on the different room. It says debate room 1.
Debate room 1, not this one,
yes,
is it?
Yes. I'm really sorry, doctor.
Oh, okay, because I was just told to come to this room.
Yeah, really sorry about that, sir.
Okay, debate room 1, is it?
Yes.
Okay, so I will leave this room.
All right. Thank you so much, doctor. I just want to check if Dr. Aznida is here with us. I believe that Aznida is supposed to be the last jury for this room. Hello, just a quick update. We are waiting for Dr. Aznida to come, and please be patient. Is Dr. Asnida has already here? I'm really sorry, guys, for the delay because we are waiting for the other jury, which is Dr. Asmida. Right, he's on his way. I'm really sorry, she's on her way. Hi, I just want to check if Dr. Asnida is here.
Yes, I'm here.
Yes, thank you very much, Doctor. All right, so we will begin the debate soon. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to the honorable lecturers, educators, debaters from the government and the opposition side, and not to forget the audiences. Ladies and gentlemen, welcome to the 6th Annual Interbatch Debate Championship organized by the Diplomatic ESCO of the Medical Association, MESTA. On behalf of the organizing committee, we are pleased to welcome you. Before we start with our debate championship today, please kindly mute your speaker throughout the debate unless you are giving your speech or point of information POI. Only the moderator and the participating teams are allowed to turn on their camera throughout the debate. The juries are welcome to turn on their cameras after the debate has finished to comment on the debate by the participating teams. Before that, I just want to know if Dr. Hassan is able to hear us. Me?
Yes, now okay. Now it's okay.
All right.
I can hear you.
Yeah, good. Excellent. Okay, so welcome to the second preliminary round of Interbatch Debate Championship. I am Dania Azizi bin Muhammad Yusof, the chairperson, and Ahmad Iqbal Hakimi bin Sulaiman, the timekeeper for today. we are very delighted to announce the motion for today, which is this House believes that healthcare professionals who refuse COVID-19 vaccination should not be allowed to practice. Before that, I would like to introduce the debaters for today. Taking the role as the government is the planet that its magnetic field is 40 times stronger than Earth, the largest planet, Jupiter, which is representing year one, with the debaters of the first speaker, Nur Adriana Natasha bin Muhammad Adlan, the second speaker, Faradina Arisha binti Azizur Rahman, the third speaker, Nur Amalina Sabrina binti Abdul Muttalib. Now, taking the role as the opposition team is the planet that its long day is equivalent to 42 years on Earth, the coldest planet, Uranus, which is represented by the first speaker, Amir Ashraf Azrai bin Saiful Amri. The second speaker is Fatur Rahman Haziq bin Tahir. The third speaker, Muhammad Adib Lokman bin Khairul Azman. Now with us, there are also three adjudicators who will adjudicate this competition. The first jury is Dr. Siti Azniza bin Abdul Karim. The second jury is Dr. Hasanan Esam Yahya Talib. And the third jury is Dr. Chin Sin Wei. Now, I would like to give the rules and regulation for today's debate. The time allocated for the first speaker of the government team is 7 minutes. The timekeeper will ring the bell once. Hi, do you guys can hear me? All right, nice. Sorry about that. Let me repeat. The time allocated for the first speaker of the government team is 7 minutes. The timekeeper will ring the bell once. At the first minute, which signals that the point of information are allowed to be given from the opposing team. The bell will be ringing again. 6 minutes to signal the end of the chances for POI to be given. The timekeeper will ring the bell twice. At the end of the 7 minute, indicating that the time is up for the speakers, and the speakers should do his or her closing speech immediately. Any POI given before the first or after the 6th minute should be ignored. Please do keep in mind that an extra 1 minute is given for the speaker if the speaker has a poor internet connection during the speech, which the timekeeper will take into account the extra minute. For the rest of the speaker, the time allocated for them to deliver their speech is 6 minutes. The bell will be ringing once, the first and the 5th minute to signal that the duration of POI can only be delivered. Any POI given before the first or after the 5th minute should be ignored. The timekeeper will be ringing the bell twice. At the end of the 6th minute to indicate that the end of the time for the speakers to deliver their speech, and they should do closing speech immediately. The speakers will be penalized if the time taken exceeds the allocated time. Again, an extra 1 minute is given for the speaker if the speaker has a poor internet connection during the speech, which the timekeeper will take into account for that extra time. Now, let me briefly declare the rules of the debaters. The first speaker of the government and the opposition team needs to define the motion and state their stand, as well as introducing an idea or more to support or against the motion. The first speaker from the opposition also needs to rebut the idea given by the first speaker of the government team. The second speaker from the government and opposition team needs to convey 2 or more ideas to support or oppose to this motion. In addition, the second speaker of the government team needs to rebut the idea given by the first speaker of the opposition, while the second speaker of the opposition team needs to rebut the ideas given by the second speaker of the government team. The third speaker need not to introduce new ideas and need to rebut all the ideas given by the first, second, and the third speaker of the other team. For the reply speech, the time allocated to prepare is 2 minutes, whereas to present the reply speech is 3 minutes. The first or second speaker from the opposition team should present his or her reply speech first, followed by the first or second speaker from the government team. The speakers cannot introduce new ideas and will need to summarize their arguments to reaffirm their stance regarding today's motion. The third speakers are not allowed to present the reply speech. The timekeeper will ring the bell once, seconds minute as a last minute warning, and will ring the bell twice to signal the end of the debate. Are the participants clear of the rules and regulations? So, as the rules and regulations are fully understood, I would like to call upon the first speaker of the government team, Ms. Nur Adriana Natasha bin Muhammad Adlan, to deliver her speech.
To provide the best healthcare quality for the society, we should start with the person who involved in the healthcare system itself. For that, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good evening to the speakers, timekeepers, judges, government opposition, and also members of the floor. Ladies and gentlemen, today as the first speaker for today as a Prime Minister, we do agree as a government that this House believes healthcare professionals who refuse COVID-19 vaccination should not be allowed to practice. Before I start, I will start with the definition. So what if healthcare professionals? Healthcare professionals is the one that will maintain health in humans through the application of the principles and procedures of evidence-based medicine and caring. Essentially, a health professional is a person trained to work in a health or health-related field. Vaccination, according to CDC, vaccine is a preparation that is used to stimulate immune response against a disease. Vaccination is a treatment of vaccine to produce the immunity against a disease, and in this case, the complete vaccination for COVID-19 consists of 2 doses of vaccination and 1 dose of booster shot. Practice of medicine means the clinical prevention, diagnosis, or treatment of human disease, injury, or condition requiring a physician to obtain and maintain a license in compliance with the Medical Practice Act of member state. Revoking or suspending their license to practice medicine is not permanent. Once they are full vaccinated, they can then reinstate their position with the healthcare field. So you must be wondering, what is the debate for today? So the debate today is all about providing the best healthcare possible for the public and also protect the healthcare professionals. And this is applicable and not valid if the healthcare professionals did not have valid health reasons without any health concern with doctor referrals. They should not be allowed to obtain medical license to practice in Malaysia, or if they do have the license, they should be revoked until they decide to get the vaccination.
POI.
Wait, sir, I will finish my point first. In other words, they will only obtain the license back once they are fully vaccinated. Our burden of proof, if we will prove to the floor why healthcare professionals without medical exemptions who refuse the COVID-19 vaccination should not be allowed to practice in Malaysia, is they will bring more harm than good. For oppositional burden of proof is to prove to us that allowing healthcare professionals who refuse in COVID-19 vaccination will not bring harm to other than, hence should allow to practice. With our 3 key points, which is welfare, fit to serve, and system. Before I go to my argument, yes, please.
Aren't you essentially forcing these doctors to take their vaccinations?
Sir, in this case, we are not forcing our doctors to take this vaccination, but we put a line where when the doctors here, we are trying to put our healthcare system first, which means that we are trying our best to give and serve for the patient and put our patient first, like what one of the 4 pillars of ethics, which is beneficence. So next, I go to my point, which is safety concerns. The safety concerns is actually not only about the professional healthcare itself, but it's also about the patients, the family, and the healthcare profession itself. The healthcare professionals, as we know, is the frontliner who have to work with the patient, whether the patient has COVID or maybe they doesn't have COVID. Still, and research from Advisor Public Health Emergency Collection in 2020 shows that 50 out of 703 healthcare officers were found positive in COVID, which means that this health officer is the one who is very in a high risk of having this virus. So this safety is not only about the healthcare officer. What about the other patients? What about their family members who are not in positive COVID? In this case, we are not only looking at the professional healthcare itself, but we also think about the close contact, the casual contacts. And without taking the vaccine, we increase the risk of us and for them to get infected by the virus. And putting the safety of our patient in danger, which means that we, as a houseman, as a healthcare professional, breach one of our 4 pillars of ethics, which is non-maleficence. So non-maleficence is that we doesn't do harm to our patient. So I want to ask the opposition, when we do harm to our patient, doesn't we breach the 4 pillars of ethics that we, as a doctor, should follow? So we, as a medical practitioner, have and always have to be do the best for our patients. But then, if we didn't take this vaccination and if we didn't do this restriction towards the medical practitioners on this matter, will we reduce or at least reduce the transmission of the disease? For example, we can take hepatitis B as an example. It is compulsory in 1989. So I will ask the opposition, why not right now we put this matter in line where we don't have, why don't we try to make this compulsory and make a preventive measure in the healthcare worker? And what I want to show today to all the members of the floor, that by revoking the license of the healthcare professionals who refuse the COVID-19 vaccination will increase the safety of the patients and families. Because at the end of the day, we all should have to agree that prevention is always better than cure. That's all from me. Thank you.
Thank you, the first speaker of the government team. Now, I would like to call upon the first speaker of the opposition team to deliver his speech.
A big good evening to the judges, members of the floor, and ladies and gentlemen. My name is Amir Ashraf Azra'i bin Saiful Amri, and I will be the first speaker for the opposition. The topic of our debate is that this House believes that healthcare professionals who refuse COVID-19 vaccination should not be allowed to practice. The government has stated that they believe in this statement, and we do agree with the definition given. However, we, the opposition, believe that this statement is false. We believe that healthcare professionals, and I would like to really put pressure on the point that healthcare professionals in this case are doctors who refuse the COVID-19 vaccine, and we believe that they should still be allowed to practice. As the first speaker of the opposition, I will be talking about why healthcare professionals, doctors specifically, shouldn't be barred from attending to patients if they were to refuse the COVID-19 vaccine. The first speaker of the opposition stated that that healthcare professionals are at a high risk of contracting COVID-19 and are able to spread it to their patients or other doctors to work with them. But this is wrong, because it's something that is that has been worked on since, the healthcare system is something that has been developed over the years. And with in light of the current COVID-19 pandemic, the proper safety measures have already been taken. So I feel like this statement is false, because doctors or it is compulsory for doctors to be wearing masks. Another statement that was brought up by the government is that they brought up Hep B and they tried to compare it to COVID-19. However, COVID-19 has different concerns compared to Hep B, and I will be explaining that in my points. Sorry. I would like to start with my first point. I would like to start my first point with the question: is what are doctors? So doctors are people with a medical degree, the people who have endured one of the longest, or if not the longest, degree course in Malaysia that takes 5 years of their life to complete. And even then, they aren't finished with their career path, as it continues down the line with starting off as a houseman and then a medical officer and so on and so forth. But that's straying away from my point. Basically, what I'm trying to say is that doctors aren't dumb. That's a general view of society on the title doctor. When they hear that title, they immediately think, oh, that person is knowledgeable, which shows just how much reputation a doctor has in society. And so who are we to question that? Yes, sorry. I mean, yes.
All right. You're saying doctors aren't dumb. Okay, that is not what I'm gonna ask. I was asking. I'm gonna ask. You talked about proper safety measures being taken, whereby doctors wear masks, right, to reduce COVID-19 transmission. Why are there even vaccines in the first place? If they're wearing masks would solve the problem, then.
Saying that says that vaccines are the only preventive measure, which one of my other speakers will be elaborating more on. However, that is not the case. And I feel like forcing them to take vaccines isn't the right cause of action in this case. Sorry, I would like to continue with my point. So doctors aren't dumb. That's a general view of society on the title doctor. But when they hear that title, they immediately think that the person is knowledgeable, which shows just how much reputation the doctor has in society. And as who are we to question that, especially as medical students? We know just how much we have to struggle and endure, all for the sake of this degree. With that basis being laid, doctors won't believe baseless arguments or fake news. Do you think they're going to look at some fake news promoting false health information and think, hey, that sounds true. I'm going to preach what I just read, despite no credible source? No. Doctors are smart enough to do their own research. And the doctors who refuse the vaccine believe that the COVID vaccination has its flaws and that the flaws outweigh the benefits. Speaking of the flaws of the COVID-19 vaccination, this brings me to my next point. Let's talk about vaccine mortality rates, and not just the various COVID-19 vaccines. No matter what vaccine you take, be it Pfizer, Sinovac, AstraZeneca, or the other vaccines available, they all share the same side effect, which is death. So what's the point of taking it if it can result in death? The mortality rate of taking these COVID-19 vaccines is surprisingly around 0.16%. And just hearing this, you might think, oh, 0.16% is barely anything. But if we look at the grand scheme of things, 0.16% of the population of Malaysia, which is 32.37 million, is equal to 51,792. You might say that 0.16% is such a rare case. But when you're in a field that is as important as the medical field, you realize that 0.16% is in fact a big risk. If you consider the 51,000 people who have faced the worst of the side effects, the fact is that the percentage can be presented with a number that we can write down is concerning. These mortality rates are a bit too high when compared to other disease vaccinations. Thus, to these doctors, they don't believe it'll be a good vaccine for COVID-19, and they aren't in the wrong for refusing to take it. Am I right? This leads me to another point, and that is the contributions of a doctor to their community. What is the contribution of a doctor to their community, and how does it impact the community? They improve the quality of life in communities. Without them, the community can't run. Therefore, we need as many doctors as we can get hold of, where we can say that our relationship is the more doctors we have equals the better quality of life the community gets. If you were to throw away those doctors, there would be less doctors working, thus an increase in the available doctors' workload, which reduces the quality of the treatment given. What the government is suggesting here is that they are willing to reduce the quality of the community, quality of life of the community by barring the doctors from practice, because the less doctors there are, the less quality of life. And less doctors also means more stress towards vaccinated doctors, as they are the only personnel available and have to work more shifts, which can potentially ruin the healthcare system as it is now. So So everybody, ladies and gentlemen, in conclusion, we believe that healthcare professionals should in fact not be barred if they were to refuse the vaccine, and it makes sense that these concerns are raised by these doctors. Thank you for listening.
Thank you for the first speaker of the opposition team. Now, I would like to call upon the second speaker of the government team to deliver her speech.
Am I audible? According to the Ministry of Health, only today we have 627 cases, and also only today 2,071 people has recovered. That is quadruple higher than those who have been infected today, and today 95.7% of people infected and of COVID are quarantining at home, meaning their COVID-19 level is below level 2. And only 4.1% are in the hospital today, meaning only 26 people out of 627 people are in the hospital. In comparison to the MOH COVID-19 daily data before the existence of COVID-19 vaccination, this data is much more better than the older data before the existence of COVID-19 vaccination. What we are trying to say is the vaccine actually works. Ladies and gentlemen, today, the side of government, we will be giving a few rebuttals with the side opposition, as well as presenting more elaboration regarding our main point, which is fit to serve and system.
POI.
Later, sir, please let me finish my point. My first rebuttal from the first speaker of the opposition is that they are trying to say that the doctors are not dumb. But to me, if the person in the healthcare system are not trying to take the vaccine, they are absolutely trying to disregard the science behind medicine. And not only that, preventive measures such as masks, hand sanitizer, and other equipment like the doctors usually wear, like the PEs and other things, they are not the definitive way of preventing the COVID-19 bacteria or virus to get into our body. Because even with masks, even with all these preventive measures, with hand sanitizer, we cannot, that is just a part of when the COVID is still there. COVID-19 vaccination is supposed to stop variants from becoming even more aggressive, variants to even more be produced by these people who did not want to take vaccinations. The other thing that okay, yes?
You say that today, you say with your data that today is better than before, right? That these vaccinations have decreased that have improved quality of life of Malaysia. We don't disagree to that. We actually agree with that. But what I want to ask you is that if it's so better now, why are you implementing this motion now? Why are you trying to bar these doctors now, even if the situation is so good today?
Because we could do so much better. As a human, we always have flaws. In our system, there's always flaws. As a doctor, as a member of the community in Malaysia, we are trying to make our country even better by providing this guideline, making sure that people understand that we as a healthcare provider, healthcare that is under the Ministry of Health, we want the best care for our patient. By providing this guideline that the people from the healthcare worker aren't able to practice, there is some sort of trust that we are able to form with the patients and the people of Malaysia. Other than that, he also mentioned about hepatitis B not being the same. How is hepatitis B vaccination different from COVID-19 vaccination when they're both from the same way of making the vaccine? Hepatitis B is supposed to prevent someone from getting a liver cancer that is induced by hepatitis B virus. COVID-19 is supposed to prevent people from getting even worse symptoms like pulmonary problems and even further that can cause fatality. That's how they're both the same. That is how we see they're both the same. They're supposed to reduce the chances of someone to not get liver cancer, and another one is to prevent them from getting even more symptoms, more severe symptoms. Okay, that is all for my rebuttals. The next is I'm going to get into the main point, which is how is healthcare worker is fit to serve when they refuse to take COVID-19 vaccine. Health is based on science. How we treat patients from the moment they come in, we ask for their medical history, take vital signs, assess condition, and we give medication, and lastly, course of treatment. That is all science. So how can we deny the wonders of vaccine when vaccines are also based on science? And if they don't trust the science behind the vaccine, are they even fit to work in the healthcare field? What about the health itself? How are they going to work having such low immunity against COVID compared to others? How are they going to treat patients with COVID? If there are people who refuse COVID-19 vaccines, I repeat, refuse, get sick, how are we supposed to find replacement? That would be a hassle itself to find someone who needs to carry more responsibility in such a short amount of time, on top of their own responsibilities, which then lead to the ultimate mental health killer, burnout. Why are we putting more strain on the doctor that are not refusing COVID-19 vaccine just to entertain those who are ignorant? Another point is system. How are we supposed to justify as a medical practitioner that any new drugs, new procedure to be safe if the one thing that has been proven for years to be safe and effective, which is vaccine, is not being mandatory all over the world. For example, the smallpox vaccine that was created in the year 1796 by Edward Jenner has completely eradicated the disease, making it possible for our newer generation to live well to this day. Could you imagine if the healthcare system itself has its own shadows of doubt against vaccine? How are we supposed to fight against the anti-vaccine community out there when a treater inside our healthcare system is still treating patients and is upholding the dignity of medicine? And with that, I would like to rest my case.
Thank you, the second speaker of the government team. Now, I would like to call upon the second speaker of the opposition team to deliver his speech.
Okay. Good evening to Mr. Chairman, ladies and gentlemen, and also the judges. So today, the topic of our debate is that this House believes that healthcare professionals who refuse COVID-19 vaccination should not be allowed to practice. And we, the negative team, will still believe that this statement is false. Before I come to my point, first, I want to rebut something from the second speaker of the government team that says about vaccines. The vaccines is like you said is a preventive measure of to prevent the disease from spreading. And now, until today, that almost 82% of Malaysian people had vaccine, and this will open the opportunity for unvaccinated practitioner to do their work again, because we almost come to herd immunity, and this will lowering the risk of the patient. Like maybe the practitioner have COVID, but as I read an article that may get from a doctor that I forget the name of the doctor, but sorry, no. They said that if the practitioner have symptoms of disease, they need to test it about it. Okay, so now we come to my point is that this motion is barring free thinking of the doctors, which allowing these doctors to reason on the most appropriate treatment for the disease. Like they may disagree about taking the vaccine, but it may also give them the chance to find the better treatment for the disease than just a preventive measure. Yeah, wait. As we need, as they may come to this agreement,
POI?
and we need. Sorry, no. Let me finish my point. We need to preserve this free will, as this motion is violating the fundamental of this principle of the free thinking will, and this allows them to reason on the most appropriate treatment disease by prohibiting the healthcare professionals to practice. Just because they refuse to get vaccine and you prohibiting them, but they have the thought of that the vaccine is ineffective, and the way this government promoting exalting the vaccine is like the vaccine is is the only way to treat this COVID-19, and it will impede
POI?
the conceptualization. Yes.
Okay, so sir, today you
Yeah.
said that vaccine is not the only way. So
Yeah.
can you give another alternative else than vaccine to prevent the new variant from coming? Thank you.
Okay, we may not have it yet, but from the vaccine only we depend on it. It's like we are too dependable on the vaccine alone, and not like after most of Malaysian have this thinking that after we get vaccine, we can we can like we can not applying the SOP maybe, and this will this will make this will bar the professional healthcare professional from practice. And when the vaccines is only the only method we're promoting, this will disregard the other methods that are equally effective for 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 treating this. And this will hindering the development of better idea that may help the community. And my second point is it it is promotes the further violation of this principle, as it serves as the stepping stone for banning other ideas or thoughts, because people people want to believe what they heard, and they heard that the vaccine is only the way, and not and you not and we as authority have failed them. And this impede, as I say, is this impede the development for better treatment in other diseases. And so we are stuck with current
POI?
treatment, sorry, no, that may have treated the disease, and less better treatment than could be, and this could be better and could save more life. With less development of better treatment, this will make us stuck in a loop, which we still depending on the vaccine alone. And to conclude, by violating this principle, as I said, they will impeding the development of the better treatment for patients and the doctors. Thank you.
Thank you, the second speaker of the opposition team. Now, I would like to call upon the third speaker of the government team to deliver her speech.
All right. Am I audible? Can you guys hear me? All right. Panel, I'll start my speech in 3, 2, 1. Panel, the biggest trick that the devil has ever pulled was to convince us that he didn't exist. It is extremely regrettable that COVID-19 has left the global community socially, economically, and culturally scarred. But amidst this destruction, science will still persist, hence the production of vaccines. The choice then becomes whether we conveniently reject it or we embrace it for the greater good of humanity. Before that, Assalamualaikum and a good day I bid to the experienced panel of adjudicators, precise timekeeper, formidable opponents, on-site opposition, worthy comrades on-site government, and members of the floor. Here's how I'm going to structure my speech. Firstly, I'm going to forward several rebuttals to the first and second speakers on-site opposition, contentions and responses included. Then I'm going to move on and summarize our case on-site government. Allow me to start my rebuttals with the first speaker. He looked very, very charismatic, but unfortunately, his points, his arguments weren't as charismatic as his looks. He came and spoke about how I'm honestly very, very clueless as to what their key points are on their side of arguments. But he came and spoke about proper safety measures have been taken. That's why doctors wear masks, and hence doctors shouldn't get vaccinated, right? Ladies and gentlemen, my question is, if masks are really that effective, why are vaccines? Why are there even vaccines in the first place? Why would people go through so much trouble to try and search for vaccines to try and to prevent COVID-19? That's my rebuttal. And then he came up and said, doctors aren't dumb. Doctors have a good reputation in the society. Ladies and gentlemen, if doctors have such a good reputation within the society, what impression would this leave within the public if doctors themselves refuse the COVID-19 vaccination? That is my question to be answered by side opposition. And then he came up and he rebutted my first speaker, and he said that doctors should also be allowed to practice as vaccination also results in death. He said 0.16% of people who get the COVID-19 vaccination eventually eventually die in some way. My question to side opposition: what is the percentage of people who die without COVID-19 vaccination? Please answer that on side opposition. And then moving on to the second speaker. The second speaker came up. I honestly had no idea what he was trying to convey, his message to the floor. He said that the more doctors, the better. Sorry. This was also under the first speaker. He said that the more doctors, the better the quality of life. What about the quality of doctors, ladies and gentlemen? What about doctors who don't even believe in science? We are allowing them to practice within the science field. How are they expected to treat patients, to treat the public when they themselves aren't in the best form of health? Ladies and gentlemen, he also talked about, moving on to the second speaker on side opposition. He came with rebuttals. Vaccine is a preventive measure. There is already herd immunity, so we don't need to bar doctors from practicing. Ladies and gentlemen, if we do not get the vaccine, there is risk of mutation of the virus. We all know that COVID-19, SARS-CoV-2 is an RNA virus. There is a high tendency for it to mutate, right? And hence, why there could still be variants. There could still be, as we know, Omicron is a variant of COVID-19, right? So without this vaccination, we are putting the public at risk. And hence, this means that we are not holding on to one of the main pillars of ethics in medicine, which is non-maleficence. We are putting the public, we are putting the patients that we are treating in harm's way. All right. And then he came and talked about give them a better chance to search for other preventive measures. He talked about after we get the vaccine, we will no longer apply SOPs. We promote vaccine when we are neglecting other effective ways to prevent COVID-19. Side opposition, please come and prove to us what other effective measures can be taken to prevent COVID-19. Why would we go through the trouble of finding the vaccine in the first place if it's not as effective as you guys are claiming it to be, right? And then he also talked about, that's essentially what he said. He said that we are restricting the freedom of will. Vaccine used to treat COVID-19. Ladies and gentlemen, we are not restricting the freedom of will. They still can. They can still decide not to take the COVID-19 vaccination. The only consequence is they will no longer be allowed to work within the healthcare field. That's it. They are still allowed to make the decision whether or not they want or they do not want to get the COVID-19 vaccination. Moving on to some of the POIs on side opposition, the third speaker came up and asked, aren't you essentially forcing these doctors to take the vaccination? I've answered that. We are promoting, yes, if they were to work within the medical field, they have to take the COVID-19 vaccination. Why? Because they will then put other healthcare professionals, they will put other members of the public in harm's way, which is against one of the few pillars of ethics within medicine. So allow me to summarize our case on side government before I end my speech. The first speaker came up and she talked about welfare. She talked about maintaining the welfare and safety of other healthcare professionals. She talked about how this mechanism where we do not allow healthcare professionals who refuse to get the COVID-19 vaccination without any health reasons from practicing medicine, how this will maintain the welfare of other healthcare professionals and also the public. And then the second speaker came and talked about fitness to serve, whereby if you yourself don't believe in the science in the medical medicine of science, why should you be allowed to work within the medical field, right? Within the healthcare field. And then she also spoke about lastly, she also spoke about the system, how inconvenient it would be if unvaccinated doctors were to be allowed to work within the healthcare field. What will happen then if once they get sick? How much inconvenience that will cause them? How much disruption that would be within the system? I think that's it from me. With that, I would like to rest my case. Thank you.
Thank you, the third speaker of the government team. Now I would like to call upon the third speaker of the opposition team to deliver his speech.
Okay, I'll start. Ladies and gentlemen, I would like to imagine you a situation. Imagine someone was pointing a gun at your face and telling you to sign a document, do you still have, and the government will say to you, they still have a choice. They could sign the document, or they couldn't, or they wouldn't. But they fail to see the fact that that we have a gun to our face. Now, is that really a choice? What government is basically saying that, oh, there is a choice, but if the other option is to be cut off from your only source of income, do you think that they still have a choice in that matter? Is a question I asked to side government. Now, with that said, I would like to tackle each rebuttal given by the government whip. The third speaker of Team Saturn. Now, she has gone through many lengths saying that what proper safety measures, what other way can we prevent this fact? What other way can we prevent this pandemic? It's becoming an epidemic now. Well, there is masks, proper safety equipment. That's what we have. And sure, these measures are not as effective as the vaccine, but there's still safety measures that should still be considered. And I would like to clarify, because for some reason the government still has not gotten into their skulls. We are not denying the efficacy of the vaccine. We are not saying the vaccine is bad. We're trying to say that there is legitimate concern for these doctors to have, so that they refuse to take the vaccine themselves. Now, with that being said, before let me speak my say first. First of all, they have said about welfare, right? Now, the frontliner doctors are the frontline doctors. These doctors who has lots of posting COVID with high risk to patients. Now, let me say this. First of all, right? First of all, these doctors who are posting to COVID are of course going to be vaccinated themselves. That is proper safety procedure, right? We are not trying to take away the procedures that have been stated. We are trying to say for these doctors that don't take the vaccine, that they don't go to these posts, right? And also, they say that if these doctors are so smart, why do they disregard the evidence that has been presented to them? I say the evidence is clear enough. There are many studies that show that these vaccinations have serious side effects. There are lots of side effects, including death. And I agree. That other vaccinations. Let me finish. I agree that other vaccinations also have side effects, but what we're trying to say is that the frequency and severity of these vaccinations, of these COVID-19 vaccinations, are so much of a concern that certain doctors don't want to take them. Now, they have also said that they want quality doctors. These doctors, just because they don't believe that these vaccines are good or not as effective as we might seem, then they're not quality doctors. Let me point something out. They are only saying that these COVID-19 vaccinations with proper evidence are not as effective as we make it out to be. They're not like they believe, and I'm pretty sure all of you can agree that they can agree as well that the vaccination for polio is effective, that the vaccination for hepatitis B is effective, that the vaccination for smallpox is effective, but they just cannot agree to the fact that these COVID-19 vaccinations are not as effective as we make them out to be. Therefore, I am not finished. I'm very sorry. I'm not taking any more POIs. I'm very sorry. But the thing is, we're trying to say that the only thing we're trying to say here is that they have legitimate concern, right? And with that, I proved that these doctors have a basis and are smart enough to say, and are not dumb, but they have a basis. They have evidence that supports their theory, even if it might not coincide with ours. Now, let me summarize what my team have said and what has been failed to be countered by the site government. What we are trying to say is that these doctors are invaluable to our communities. These doctors, they contribute a lot to our community. And what we're trying to, and they would come up and say about the pillars of ethics, of non-maleficence. I propose, what I say to you, this motion is violating the fundamental principle of free thinking in doctors. Without free thinking, by violating these, but my second speaker has told to you, by violating these principles, what you're basically doing is setting a precedent for other violations of this principle. So one day you're gonna say, oh, you're not allowed to think that these vaccinations are bad. Then another day you're gonna say, oh, you're not allowed to think that this medication is bad, that this treatment is bad, that this prophylaxis is bad. What you're doing is setting a precedent for further violations to free thinking. Now, with that being said, I would like to ask the audience and chair, do you want to live in a world where free thinking is suppressed and our valuable doctors and the value of our doctors are flushed down the drain just because they believe in one thing? Then please vote for site government. Thank you very much.
Thank you, the third speaker of the opposition team. As the debate is reaching its end, I would like to allocate 2 minutes for the first and the second speaker from both teams to prepare their reply speech. Now, I would like to call the first or the second speaker from the opposition team to present his reply speech. Is Ame still here with us?
Ame has a blackout.
All right.
Okay.
Can we wait for Ame to come back real quick? Or is that possible, or do we have to proceed with Afator?
Sure, if it's fine with everyone.
Is Team Saturn okay with waiting for Ame?
Jupiter, by the way. Yeah, we're fine.
Oh, Jupiter. I'm so sorry. I'm too caught up with the previous debate. Okay.
Hi, Adib and Fatu. Is Amis going to be out for a longer time? Because if it is, there will be judges waiting for the discussion, right? So
Oh yeah.
Okay.
if you don't mind, we can have another representative from your team to have the reply speech going.
Give me a sec.
Wait. Okay, let me to the reply speech. Okay, so good evening again to all people and judges. So this case, this motion believe that healthcare healthcare professionals should not be practicing because they're not taking vaccine. From our point of view is that the government is not believing in our doctor and their own principles. And this will only reduce the quality of our doctors in the future if we're not believing in them. And we only put the vaccine as the as maybe a smoke for not allowing them to practice their knowledge. And we believe that maybe among these unvaccinated doctors have a better way and maybe a very good quality to treat people even they need to risk their life because of they are then not very immune for COVID. And we still stand with our belief that we should allow them to we should allow them to be we should allow them to be practicing their 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 license, their medical license to treat people because as a doctor, saving people's life is the most important thing to do to them. And as we embark our epidemic journey and we will find our very solution to get a better treatment, we should at least allowing them to treat the patient in it who is maybe low risk and vaccinated patient, so so we can reduce the burden of other medical practitioner to and helping them to be to have a better treatment. Thank you.
Thank you so much, the second speaker of the opposition team. Now I'd like to call upon the representative from the government team to give their reply speech.
Am I audible? Okay. Ladies and gentlemen, before we end this debate, in this reply speech, we, the government, will provide a comparative analysis of the strengths and weaknesses of the case of both sides. I will also prove to you why our side has won today's debate. We have successfully proven our burden of proof of when the side of opponent do not even have a structure in their argument, which fails to prove their burden of proof itself. We have proven how allowing these people to work within the healthcare ecosystem does more harm than good under the key point of welfare, fit to serve, and system. In our welfare, we have discussed that we want the highest possible safety towards our patients by ensuring that our healthcare worker has taken the latest vaccination for the latest pandemic, which is COVID-19. And by doing so, we are implementing the 4 pillars of ethics, one of the 4 pillars of ethics in medicine, which is non-maleficence. Second is the main point, which is the second point, which is fit to serve. In this main point, it is our responsibility to make sure the efficacy of our healthcare system is not affected by this ignorant healthcare worker that refused to take COVID-19 vaccine, which in the end will be more prone to sickness and creating newer variants. Lastly, the last main point is system. So, system, when there are systems among our healthcare, we are able to track how our healthcare and our development in science are able to reach a new part of our journey. So meaning, when our healthcare system has lesser disease, the more we are susceptible to, more are we successful in trying to prevent newer disease. In this world, we being human, we have to live up to our name, which is by being humane. And being humane is service above self. Not only that, as a healthcare worker, on top of also being humane, we are also supposed to be the safe space for sick people, a place for people to trust when they are at their most vulnerable point of their life, physically and mentally. Why are we trying to give a path to those who are giving more harm than good to this healthcare system? Is our mission to sabotage the healthcare system? We must own up to the oath that we take at the end of our journey of our medical school. That is all for me. Thank you.
Thank you for all the debaters. Now, we will give some time for our educators to carefully give marks and discuss who is the winner of today's debate as well as deciding the best speaker. The juries will now enter the breakout room to have a moment among themselves. Please wait as the committee are setting up the room. For everyone's information, the jury will judge the debate based on the points argued by the speakers and not their personal opinion about the motion. Hi guys, just a quick checkup. Is all the doctors are here now? Dr. Chen, Dr. Hassanan, and Dr. Aznida. Are you guys are here?
Yes. Yes, I am.
Yes, we are here.
All right. I just want to show if you guys have done with the discussion.
Yes, already.
Yes, done.
All right. That is perfect. All right. The time that we all been waiting for. The results are in my hand as usual. But before that, we would like to hear a little feedback from the juries. So I would like to call upon the first jury, which is Dr. Siti Aznizda, to give her feedback about the debate that had happened.
I think overall, is a good topic. I mean, it's quite challenging since we are all in the medical field. So there might be some bias into when we see the topic that is given. But still, I try to be fair as much as possible and try to evaluate all the points given by both of the teams. I think that's all.
All right, thank you so much, Dr. Aznizda. Next, I would like to call Dr. Hassanin to give your feedback about the debate just now.
Okay. Thank you, Daniel, moderator, for this activity. Actually, I would like to say special thanks to you because you are well organized in your presentation and your managing of this session. So special thanks to you. Number two, I am happy to be a judge for this activity, and this is, I think, my fourth time to be judge and jury for this activity, and I'm happy for this. What I would like to tell you, and you transfer this to other students, we as you are lecturer, we want you to do such kind of discussion during class as well. We want you to be brave. We want you to take this discussion and show it to other students to be like that during the class. This is the main idea. We want you to be brave in discussion and expression of your idea during the class. Today I have class with you one. I am like force them to talk. Try to take information from them one by one. So this is the most important and benefit outcome from such activity. Apart from that, this topic is fit for this time because this debate in this topic, believe me, it's present all over the world. In each country, there are some supporting, some two teams, and one opposite the other. But anyway, each team has its own idea, its own supporting and against idea for this topic. Anyway, my congratulations to winners and to presenters and to all of you. Thank you very much. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Alaikum salam. Thank you so much, Doctor, for your feedback. So to complete our feedback session for today, I would like to call upon the third jury, which is Dr. Chen, to give the feedback of the debate that had happened. Dr. Chen, can you hear me?
Okay, sorry. Okay, I would like to thank you very much to the moderator. I would like to congrats to everyone. I'm sure that you have gained a lot throughout the process, from the moment you prepare for this debate until today. But do take note that during the debate, you have to give reasons to support your viewpoints, examples, and facts to be referenced, especially if you are from the government side, of course. Even if you are in the opposite side, you need to have what we call the evidence-based medicine. Okay, and there is an assessment for rebuttal, hence you shall always open the chance or opportunity for someone to raise POI. And looking into this this topic, you need to have a bird's eye view, not only zooming into medical doctors, because you know that healthcare professionals, the definition is quite wide. And what about other professions, for example, like teachers and so on, right? Congrats everyone, well done. And I hope you can continue with this momentum and have a more discussion, interactive and constructive comments during, and also the critical analysis throughout your medical education years and also in your future. All the best to you. Thank you.
Thank you so much, Dr. Chen, for completing the feedback session. So, as always, enough of the nerve-wracking moments for all of you guys and the audiences. Are you guys ready for the winners? So, the winner for the second preliminary round of Interbatch Debate Championship goes to Jupiter from the government side. And the best
Congrats,
speaker,
guys.
best speaker chosen by the juries is Miss Nur Amalina Sabrina binti Abdul Muttalib from the government. So thank you, congratulations everyone. And as always, before ending our session today, we would like to have a photography session, including the juries and the participants. So if you guys mind, please turn on your cameras and take a big smile before we capture. Can I have someone from the committee to screenshot?
Yeah, sure.
All right, thank you so much, Zul. All right, on your count, Zul. Are you ready, Zul?
Yes, yes.
On your count.
Ready, three, one time, three, one. The last one, the third one. Right.
All right, that is the end of our second session of debate. So thank you so much for this amazing debate of everyone. And thank you for the juries who are willing to spend their time this evening. So hope you all have a great evening ahead and you may leave this MS meetings. Thank you. See you soon.
Congrats. Thank you.
Thank you.
Thank you so
Congrats,
much,
guys.
doctors. Thank you, everyone.
Thank you so much,
Good job.
doctors.
Thank you. Okay.